So again, I want to thank the essential employees that are here day in, day out, and to all the frontline people that keep us moving. Thank you, especially our hospitals and our EMS and our prison guards, to transportation, our CDTA drivers, everybody. Thank you, thank you, thank you. Hopefully I'm not leaving anyone out, but again, I just want to say thank you for what you're doing. And, but sadly, today, I have to report 2 more Albany County residents passed away. My condolences and prayers go out to the family. We have a male and a woman, both in their 80s, that passed away, underlying health issues. But again, this brings our total up now to 41. And we reported 40 yesterday, but with the tracking and everything like that, and the state site, one of the people that passed away was a Saratoga resident. So again, our prayers and condolence goes to their families and to all the families that are living through this. It's difficult times, and especially for these families. And I've said this before, and I'll say this again, and I hope this is the last time I have to give my condolences and my prayers and our love and support to these families. And we don't have any more numbers to add. But unfortunately, this is what's going on. But I tell everyone that's home, take a minute and think about this. If you lose a loved one in your life, you can't be with them at the hospital. And only the immediate family can go to the funeral and wake. Think about that. It's tough. So now you got to bury a loved one, and people who love them can't come and support the family, and they can't pay their last respects. It's a different time we're in. So that's why we've emphasized, Dr. Whalen and I, time and time again now for almost going into 8 weeks, about social distancing, wearing masks, cleaning your hands, coughing in your arm. These are reasons that we're saying this. So as today, our numbers are now 1,120. We're up 94 from yesterday. We have 907 people under mandatory quarantine. That's up 54 from yesterday. And we have 22 people under precautionary quarantine. That's down 2 from yesterday. Our Shaker Place stays the same, numbers as I've given out every day, except now we have 4 workers that have recovered and 2 residents, which is good news. We have 2,286 people that have completed quarantine, and of those, 562 tested positive for the virus have recovered. That's up 35 from yesterday, which is good news. There are now 34 people hospitalized with a hospitalization rate of 3%. Those who have tested positive yesterday, that rate was 3.6, so that's down. And unfortunately, we have now 2 extra people in the ICU. We were at 8 yesterday, total of 10 people in the ICU. Again, we're seeing higher numbers because we are aggressively testing, and we're opening more and more sites. So you are going to see our numbers climb steady. It's what Dr. Whalen and I have said since the beginning. It's here, people. It's in the community. It doesn't matter. I know people want to see zip codes, and they want to see if it was in their neighborhood. It's here. It's here. And we can get through this together. Together, we can do anything. We're New Yorkers. So I say to everyone, let's be part of the solution, not part of the problem. And the only way that's going to work is if that, as you're home, or you come up with solutions, or you have new ways of reimagining the way the workforce is going to be, any ideas, please send them to us. Because as I've been talking to my counterparts in Rensselaer, Schenectady, we're reaching out to Saratoga, we're looking at Columbia and all over, because we have to look at a regional approach to the way we're going to open up. And the one thing I keep saying is we have to reimagine what the workforce is going to look like. I'll be dealing with the superintendents in Albany County, BOCES. How are they going to look? How are the classrooms going to look? How are kids going to look when schools open up again? And we have to figure that out. We have to figure that out. And that may mean, classes, broken up in 2 different classrooms, and video cameras broadcasting in the other room so the teacher can teach the 2 rooms at the same time. These are things we got to look at, because we got to put people 6 feet apart until we get a cure. And that's one of the things we talked about. I've been talking about the Times Union Center, the Capitol Center, the Egg, Palace Theater. How are things going to look when we reopen up, and how do you restore businesses? And we're going to be reaching out to restaurants. So more now than ever, when we have our economic development person in play, Kevin, and the advisory committee, we brought them back. Willingly they came back so we can start working with businesses, restaurant owners, owners of hotels, of saying, how can we do this strategically and safely? Because at the end of the day, it's about the safety and welfare of the residents of Albany County, and I've said that, and not just of Albany County, of the Capital District. We need to do this collectively together. We need to work with all of our health departments, and thank God I have Dr. Whalen. We're going to have to figure it out with all the health departments throughout the Capital District of how we're going to figure this out and how we're going to make this going forward. It's going to take time. It's going to take time. And I know people want to get out. I know people want to get back to work. But the last thing we want to happen is to do this and have more cases or more deaths. We don't want to avoid both. We don't want it to happen to anybody. So give us time, but I will challenge everyone like I did yesterday, that at home, and the people that are working every day, give us your solution to how you think we should run and operate going into the future. How do we do things? How do we do restaurants? We look at, do we go to 2 permanent shifts here in the county? Do I go 7 to 3 and 4 to 12 and mix the shifts up so I got less workers in the building at any given time, 5 days a week? Well, that means restaurants are going to have to be open at night, and do they figure out the same thing? So this is something collaboratively we can do together. And we've been talking to a lot of people, not just here in Albany County, but throughout the Capitol. And being president of County Executives America is something that I have talked to on a national level when I've talked to other county executives, and we're all figuring it out together. So we're not in this alone. So we can look at how things are going to work in other regions. But one of the most important issues we have, and we'll probably be putting an email to all of our workers in the county, how many are going to have daycare problems? How many are going to have issues because school's still out? How many are going to have issues because there's going to be probably no summer camps? So we have to address that issue. How do we address that issue? Do I do a second shift and bring them in at nighttime so they can be at home with their children? These are things that we got to figure out. It's the new norm. So I want to say to people that are home, when the things do start to open up, it is going to be different. It's going to be a different feeling. It's going to be a different vibe. And we have to get used to it, but we have to be strategically smart about how we do this, because it is about the safety and the health of all of our residents, not just here in Albany County, in the Capital District, and all of New Yorkers. So again, please bear with us as we do this. But again, we have the testing sites, the mobile testing sites. We have the testing site at Rite Aid, as always. That's been a huge success. Our partnership with 41 Urgent Care in Gilderland, we did get a lot of calls on that. The number's up. It's area code 518-867-8040. And again, our mobile testing sites that we've been running. And right now, we tested over 644 people. 514 tests at our Albany site, 131 of our Ward of Leeds site. We don't have the numbers in from the city of Cohoes yet. People asked that yesterday. And, out of that, we have 46 positives, but we still got to wait for the numbers to come back. So that's going to change. So I really don't want to stick to that bottom number. But again, we have the sites. They're up and running. So please get out there. If you have Dr. Whalen put a whole new criteria out there, and I thank her for that. And we've gotten a lot of phone calls, and I promptly responded to them. I said, you can call the health department. But no, we did answer them because they do a good job there. But again, Dr. Whalen.
Thank you, County Executive McCoy. So unfortunately, we still in Albany County are seeing the vast majority of serious illness and unfortunate deaths among our elderly population, specifically those that are in a nursing home or in a long-term care environment. We know, as I've said many times, that this is a very contagious disease, and that these agencies are doing the best to mitigate spread, but it takes more than their efforts, and I wanted to talk a little bit about that today. We have an amazing essential worker population in the County of Albany that is doing such important work. from a healthcare perspective, from emergency operations, from some business perspectives throughout the county. They are doing the work that needs to be done for us to continue to move forward, and their work is essential. Most of these essential workers have been well trained on infection control. If they are part of the workforce that needs to leave their house on a daily basis, they have learned how best to protect themselves, how to mask, how to utilize social distancing and hand hygiene. And we know that these essential workers are models for the rest of us in the community. But we know essential workers also go home to their families at night. And if you live with an essential worker, you have a job too. And your job is to support the work of your family member and adhere to the recommendations of social distancing and hand hygiene and wearing a mask when you're in public. If you don't do that, you are not only placing your family member at risk, but you are placing at risk every person that your family member works with. This is a group we haven't talked to or appealed to in the past, but since we're learning about asymptomatic spread, please know that if you live with an essential worker, you are part of this. Your actions determine what happens in the community, and it is just as essential for you to follow these guidelines as it is for your family member who works with the public. We all need to work together on this. If all of us work together, we can continue to keep our numbers down, and hopefully, as the county executive wishes, as I wish, as all of the healthcare professions, local health departments, and local governments wish, we will not have to be talking about more mortalities. Please continue to do your part. Thanks.
Thank you, Dr. Whalen, as always. And, you know, we are in different times these days, and many people have additional stress of trying to file for unemployment. Some legal matters, might not have the resources or means. And, you know, it's questions we've gotten about unemployment for a variety of people that were frustrated in the beginning and still haven't heard back. And most of it, the state, and I commend the governor and his team, they've working all the kinks out, because no one's been hit with this much on unemployment, and I think in the history of unemployment. But who better to ask to come here but William Moore, from the Executive Director of the Legal Aid Society of Northeast New York, to talk about what they're doing, and not just what they're doing here, but in all 16 counties. Lillian, I can't thank you enough for what you're doing for everybody, and I'd like you to talk about some of the stuff questions you might be getting asked, or things that you're dealing with.
Well, thanks so much for having me here, County Executive McCoy. I'm delighted to be with everyone and to really reach out to Albany County, which is the root of our history, really, right? Though we are the Legal Aid Society of Northeastern New York, it's serving 16 counties. So what is Legal Aid seeing now? Legal Aid strategically created its COVID-19 legal response, a large part of which is our COVID-19 legal line. It's a phone number I'd like to ask people to call it. It's 1-833-628-0087, and I think it's also on your screen, on our screen, as we're talking. Why did Legal Aid set up the legal line and create this broad COVID-19 legal response? Legal Aid knew we had to help the community respond to COVID-19. We knew that we would be a vital part of the community's response. Right now, in terms of addressing the kinds of questions we're seeing a lot of confusion. A lot of people who are having trouble filing their unemployment insurance claim or getting it processed, a lot of delays, a lot of confusion about the moratorium on evictions. And what does it mean? Does it mean I don't have to pay my rent? Or if I've lost my job or lost my hours because of COVID-19 and I just don't have the money to pay my rent, what will happen? Some landlords are out there thinking that the moratorium on court proceedings means that their only resort is to do an illegal lockout or lockout illegal eviction, and those are some of the calls we're starting to get right now. What do we expect in the future? They very much mirror the essential services legal aid always provides to the community: housing, safety, benefits, the very core of a person's needs, right? So we expect that there are going to be long delays, even if there is a denial of unemployment insurance, that there will be delays, and that the confusion about what a gig employee is entitled to, what an underemployed or self-employed person is entitled to, and what is the meaning of the new leave provisions of New York and federal law, the meaning of the FMLA provisions that now cover employees who can't work because they're required to provide childcare in their home. So that is part of what we're seeing now is confusion. What will we see in the future? We think, again, delays. We think congestion in housing, in our courts, in the filing of landlord-tenant matters. If there are disputes about qualifying for unemployment insurance benefits, if there is, right now, there's still some confusion about what is an essential matter. So can a low-income person access the courts? So, for example, in our senior legal services program, which the county provides to seniors, our intakes are a little bit lower than average. People still don't realize they should call legal aid when they have a legal problem. Some of the intakes we've received have to do with how can I handle a death in the family? Is a small estate proceeding an essential matter in the surrogate court, right? These are all matters to be determined. We have found that county agencies such as the Department of Social Services have been really cooperative and helpful to clients seeking supplemental nutrition assistance program benefits, food stamps. So we've been very thrilled about that. But again, intakes are a little bit down from the average, and so we really need people to know that while our physical doors are closed, we are maintaining access for clients to civil legal services, and they should call the COVID-19 legal line.
Lillian, thank you, because you have been the backbone of our community, not just through this, but over many, many years of helping people that might not have the resources or know how to, from unemployment to, like you said, legal matters if they're going to evict it, or just some legal matters that they're going through the court system. You have been so useful to people to help them get through their troubling times, Lillian, and I can't thank you enough for everything that you do personally, because I know your heart's in this, and I can't thank Legal Aid Society enough for helping us here in our community.
Thank you so much. And I just want to shout out to my colleagues, the staff at the Legal Aid Society of Northeastern New York, many of whom who live right here in Albany County, who have been great and put up with the challenges of remote work, especially remote work with less than terrific technology. So,
yeah.
But we have learned how to do it, and it's because of them.
Thank you.
Thank you.
No, Lillian, thank you so much. Some other news, I talked about the rail trail yesterday, and it's kind of good and bad. We actually made the Rail Trail magazine of New Jersey and New York guidebook, which is nice for our bridge and the trail that we put in there. Respecting Governor Cuomo, we want people coming from outside Albany County to come see our rail trail right now. When this is all over with, we want you to come here and enjoy the great experience in Albany County. And if you like that picture, come move to Albany County, because we'd love to have you here in your business. But again, it was nice surprise when they let us know from the magazine that they were highlighting our rail trail, which is good. I also want to remind people, if you're stressed out, as always, our mental health professionals are there for you, Monday, or actually 7 days a week, 8 a.m. to 8 p.m. As always, the number is 269-6634, also the 211 number in the New York State hotline. And I want to thank everyone that's been partnering with us through these last 7 weeks. So thank you. Thank you, thank you. Remember, as always, it's a marathon, not a sprint. Take a step back, take a deep breath. We're going to get through this.